Hi everyone, I am Tara, aka Spirit Mother, and I would like to welcome you all back to my channel on YouTube, Spirit Teachings Going in South, on TikTok, 1974 Enlightened Soul, and I'm also live on my Facebook. If you're new to my channel, I would recommend, suggest, encourage people to read the description on my YouTube channel, Spirit to Spirit Teachings of Going Within Self, to get a better understanding of what it is that I bring forward on my channel. As most of you are aware, if you're not new to my channel, I come in and talk about like just different things in life, right from politics to the medical system, or my own life. I use a lot of my own experiences in order to bring it forward because a lot of people can relate to it because we're all going through different things. Now, today I'm talking about family doctors and walk-in clinics. Okay. The reason why I'm talking about this is because yesterday I went to the doctor with somebody, and I was sitting there, and I mean, I couldn't understand. Like, I later found out that the doctor that's supposed to be his family doctor is still in residency, which my opinion is that if they're still in residency, they should actually be in a walk-in clinic setting first. Okay. It shouldn't be in a full-blown where they become a family doctor, okay? Because they don't have their full license. It's not being prejudiced against them that they can't do it because they're still in the process of learning. Okay? And when you have a new resident and they're coming in and they're with patients who's had chronic illnesses, okay? I was in there with somebody, and no word of a lie, okay, this doctor was sitting in his chair like this, slouched right back. It's like, well, wait a minute, like, that's not very professional, okay? And to me, he didn't like he didn't appear that he was into his job. He just it was like he didn't even want he didn't even want this person in there. And when he was typing up a referral, something that would only take, I'd say, about 2 minutes, 2, 3 minutes. It took him 15 minutes to a half hour. He was sitting there like this. And I swear he used a different document because the stuff they say about, like, when they send a referral to another doctor, okay, they have your past history, okay? Intake, okay, on intake. So on intake, it's where the patient was at the time that they started being your patient. First appointment you had, okay? And when I was asking him about documents, it was strange because I was asking him for a copy of the referral, but he couldn't find it. He couldn't find the referral. And all of a sudden, he found the referral, but then when I said that, this person wants a copy of the report or of the referral, it was strange because it didn't even have really, like, you have your headline, okay? And then you have who it's addressed to, and, like, dear so and so, and a letter, like something written up and what have you. Didn't have that. He never gave this person anything that was asked for, but he was very slouchy in this. It was like one of those young fellas sitting in their, what is it? There's a certain car, Honda Civic. Thank you. Right? It's like they're sitting there in the Honda Civic like this. It's like he did not put me in the mind of a doctor. Okay? He did not even seem like he wanted to be there. So when you're in your residency, They shouldn't put you in the position of a family doctor. They should first put you in they should be putting you in the position of the walk-in clinic. And in my opinion, people are going to say, well, everybody needs a family doctor. Well, people say that the system shouldn't be hooked up to one system or what have you, so that, if you need to go to a doctor, okay, because I was sitting there and this couple brought in their baby. They were there to get their um, first vaccination, and they couldn't get it. It was a walk-in clinic. They had no family doctor. Okay. Some of you don't believe in vaccines and what have you, but some people do. Okay. So there should be a place. Like it's everyone should be able to have a family physician. Okay. However, I'm like questioning, why does it, like, if they have your records, okay, I know they say certain things you have to be monitored for, okay, and I understand that, okay, but I'm going to be honest. See, when I was on medication, there was no real monitoring, or monitoring, monitoring. Thank you. Sometimes you get tongue tied. No real monitoring to it, okay? Because some doctors will give you a prescription and they don't even look, so they can't memorize everything, okay? But they'll give you a prescription and they won't check to see if that prescription interferes with the other prescriptions on. So they're your family doctor, but they're not doing this, okay? They say because the doctor don't have time. Well, I personally feel that it's not about having a family doctor because this other place where this person goes, it used to be a walk-in clinic, but now they don't take people anymore. And then people who need a doctor and can't find a walk-in clinic or can't get into a walk-in clinic, they're sent to the hospital. We were in there yesterday, 2 hours waiting for this person to get into their appointment when they had a time. Okay. And then I was standing there and the receptionist was talking to someone and they were telling somebody that with regards to these phone call appointment, they give you a time, which to me, giving you a time is an actual appointment. But they told the person that, but it doesn't mean that they're going to call you at that time. It just gives a vicinity of it. So when you go to the doctor, you have a set doctor's appointment. Basically, what you end up having to do is take a half a day off of work because you never know when you're going to get in on time. I just see it that, if there was more walk-in clinics opposed to all family physicians, it would alleviate all of this people lacking in a physician, is what it would do. But people don't understand that. And if people come into my room to insult me, go right back out the same way you come. 'Cause I don't have time for you. See, everyone's screaming because they don't have a family doctor. And some have a family doctor and, they shouldn't even have their license. If they took, okay, and they put natural medicine back in, where you could have a natural healer or a shaman or what have you, you wouldn't have this problem. It would be the patient's choice. I mean, they say it is now, but for a natural healer, physician, but you say they don't have that qualification. They have just as much qualification as a doctor that went for 7, 10 years. That doctor learns their form of medicine. Well, these natural healers learn their form of medicine. So it should all be covered under the medical system. In actuality, it's actually the patient's choice of what they choose. And I can feel that somebody's trying to choke me off, to silence me. Don't like what I have to say? You have to be in here. I'm saying this is how I feel about things, or how I see things. This person was getting a referral for hernias, okay? And I have a cousin he's in a different province. And when he ended up with his hernia, 3 months and he was in having surgery. Okay? This person that I went into the appointment with, hernia was 6 or 7 years ago. And they've been in excruciating pain. I've seen them in pain. I've seen them literally screaming, bent over, bawling. And the doctor will say, well, you're supposed to go to emerge. Most people, they don't want to go to emerge. And it's got nothing to do with how much pain they're in. It's because people will go to emerge no matter how much pain they're in, and they're sitting there for hours before they get in. So I ended up afterwards, I was looking at the paperwork, and I went up to the receptionist. I was like, this doesn't seem right. And I told them what I wanted. Well, they didn't find the referral, but they ended up finding the thank you letter, because this person that I went with, they thought that they already went to this specialist. And that's what, no, you didn't. It was your doctor who said what you think a specialist said, because they knew they didn't go. And we got a copy of the thank you letter for the referral. And I was reading it. If it's not an emergency, 48 months, you go on a waiting list. 48 months, 4 years, you go on a waiting list. Do you know how much pain and suffering, and do you know how much worse things get when they could actually, instead of going through all this bullshit of waiting and waiting, they could actually resolve it and correct it before it got to the point where it put a strain on the medical system and a lot of pain and suffering on the person. he was told, this person was told, oh, well, I guess you can't really exercise. You can't go lift weights anymore because it'll put strain on your guts, and then your intestines will come falling out. It's like, what? People need exercise for their health. And you're telling them don't get exercise because the medical community don't want to do their job? They want to keep everybody on a waiting list. Why? Because it's profitable. Here, go take these medications. Meanwhile, it's making it worse. It's not correcting it. Why they wait until it gets so bad is beyond my knowledge, because it could be so simple to correct and fix instead of putting someone through years of torture and pain because you want to make money. Because you're not doing your job. And then if the patient spoke up and said anything, well, you drop them as your patient because, well, they were the problem. They were standing up for themselves. And whoever's trying to come in and like come at me and attack me with your energy, like seriously, grow the fuck up. You must be one of the doctors that do that. Apparently so, eh? It is a bad system. It's a system that never worked to begin with. But they'll demonize natural healers. But they're actually the ones in the wrong because they're leaving people to suffer. See, I can see people with emergencies, like first, what have you. It's not part of, why wait till something comes to an emergency if you can catch it before it gets to that point? And then people want to scream about the medical system. It's that part of, it's happening that way because they have the people shackled and chained. Don't you say anything, and we'll drop you as our patient. Well, right now, this person, like because of what I've found in these documents, this person has been going to this doctor for about 4 years now. And for 4 years now, they've been trying to get the doctor to resolve their hernias. It affects their quality of life. That's what it does. And it's like, they'll make appointments for people to come in to get a prescription. And doctors should be freed up for other things. Instead of leaving someone to suffer for years. The same person had another problem. It took them years to get it looked at. And then they didn't get all of what needed to be taken out. They left some behind. And why would they leave some behind? Because they can actually see it there. They can actually get it all. But they don't. Why is that? Because it's not profitable if they get it all. I know somebody that had a big cyst or thing right on their forehead and they went and had it removed. But the surgeon didn't get all the stuff out. And now it's back again. And they'll say, oh, well, they can come back. Well, the reason why it comes back is because you don't get it to the core. You don't get to the root of the problem, which you know that it's there and you know how to get it. At least you should if you're a doctor or surgeon or what have you. You don't have to agree with me. It's that part, you wonder, we wonder why our medical system is so backlogged because things are left instead of addressed right at the time that it needs to be addressed before it gets to that point. By not doing it makes everyone's life harder. The medical community, families, it affects your home life, it affects your mental state, it affects your physical state, it affects your ability to work. And then they blame it on the people because the system is what they say overloaded. It's because their incompetence. And people being left to wait. Like I know another person that was getting hernia. They went to a walk-in clinic and got help faster than somebody who goes into their family physician to get help. You want the system to change. The change comes with you making that change. For doctors, it's not about leaving something until someone's guts are falling out or until they're full of cancer. Or until their body is so infected that you have to hospitalize them. See, it's up to the doctor to do their homework, not the patient. That's what a doctor gets paid for. They're the ones that went to school. But I'll tell you, if they put the funding where funding needed to go, they wouldn't have this problem. People who would go to a naturopath, they should be covered. Shamans should be covered as part of your medical. As part of your health care. But see, the thing is, because you live in a dogmatic system and you go by a narrative that says that this stuff is demonic, or you say that, teaching people how to use crystals to their advantage, teaching people how to use their own energies to their advantage, or others doing Reiki healing, or using psilocybins, which is mushrooms. There's over 200 species of mushrooms. And they make them illegal. Why? Because you can go out and you can pick them out of your yard. Ayahuasca. The bread and the wine. I was watching a woman channeling. The bread and the wine, and she said it was. They say it was said that it was psilocybin and ayahuasca, and I understand because the psilocybin, I pronounce it right, is the bread. It's the bread of the earth, which is the mushrooms, fungus, yeast, what have you. Ayahuasca, it's a tea tree. It's a drink. You go to your store and you buy a liquid cough syrup. But see, well, you hallucinate with that. That's why it's done in moderation. It's not about just giving somebody a mushroom. It's about teaching them how to utilize the medicinal of the mushrooms, how to use the medicinal purposes of your herbs. There's a lot of natural healers, a lot of herb specialists that know how to put certain herbs together for certain things. Like my dad, he don't understand like why we're taking all these synthetic things when honey and tea would solve honey and tea would solve a sore throat, but you go and you run to the store and you get these chemicals and you call them lozenges or cough syrup. already have the knowledge. And those people are being called forward. Put yourself out there. Don't be afraid of the system that says that, oh, well, you shouldn't be doing that. That's this, that's that. Or, they're telling you that you have to say one thing or another, but they don't. They're practitioners in one way, and the others are practitioners in another way. They know just as much what they're doing as, your medical community does. Actually, sometimes they know more than your medical community. Because they know how to do it without causing more harm to your body. Every time you go into a doctor, they prescribe you medication. Here, I'm going to tell you something. I'm going to give you a little pointer. Lower your stress. Set boundaries. And stick to those boundaries, even if you got to get pissed off at people and tell them off and mirror them back. Because if you're not doing something that you show them that you used to do and they get aggravated, well, that's on them. Because it just goes to show that they were just using you. People really need to speak up. Change the system. If you're sitting back and you're keeping, don't forget the earplugs. Oh, how am I going to do it? Okay. Seriously. Changing what you consume, what you eat, what you drink. Go for a 5-minute walk. Just go sit outside for 5 minutes, a few times a day. Go sit in a nice bath. And don't say you don't have time, because that's where you need to make time for yourself. You can't blame other people because you don't make time for yourself. And I know some of you have children, but you still have the ability to make time for yourself, because you need to set boundaries with your children too. You're not their bitch, you're not their gopher. Teach them how to do things for themselves. You see some parents and their children are 15 years old and things like that, and the parents are still catering to the children. When they should be doing it themselves. And it's like, well, who are you to say that? Well, let me see, because when my youngest son was 12 years old, because he wouldn't keep his room clean. He kept throwing his clothes on the floor, and I didn't know what was clean and what wasn't. He was made to do his own laundry. He was given an incentive for chores. but not always, because you should be teaching them to help in the house, not letting them make a mess and then you picking up after them. To pick up after themselves. It's the same as when you go to the doctor. It's their responsibility in knowing what's right for the patient. But in the end, you know what's right for your body. And if your body is having an adverse effect to it, that's when it's time to stand up to your doctor and say, hey, doc, something needs to be done here. And it's not waiting around either. It's not they should not be waiting until you are in excruciating pain and your guts are on the floor. I'm using that because that's what brought me in here. See, I know someone who's always saying about like at that time it was about Justin Trudeau, about not giving money, not doing this for people and what have you. So your federal government disperses money to each province. It's on your provincial government to disperse that money appropriately, but they're too busy giving themselves raises. It's the same as your physicians. You're sitting in a waiting area to get into your appointment, and one of these pill pusher promoters will come in, and you're left out waiting while these pill pusher promoters are in during when you're supposed to be in the doctor's. And your doctors do get an incentive for every new prescription that they write. When it's a new a new drug on the market, they want the doctors to promote it, and the doctors don't even have a real fucking clue what's in it. They're just going by what these people say. They don't look into it themselves. They're pushing antidepressants on your TV, on your commercials, and they're putting meditative. Go see your doctor and ask your doctor if this is right for you. Meditation and the inner work, internal work, is what's right for you. See, I'm looking into past life regression. And there's this one person, it's like $530 for 5 to 6 hours. But unless you have medical coverage or the $530, you don't get to go. And my question is, how's that fair? Shouldn't it be available to everyone? But see, there's those psychiatrists that will say, oh, well, no. And then they'll demonize the natural forms that these people use, but they'll send you to physical therapy and massage therapy. But see, again, if you don't have the money and you don't have medical coverage, you're stuck again waiting. I just heard, what do you think of privatization? Whether it's the government or privatized, your taxes should be paying for it. And not having to go out and getting extra medical coverage, like going out and paying for medical coverage, like these insurance companies and stuff want you to do. Because you're just paying into the same system. But it's dying, know, the president and, you know, the ones who wants to be prime minister, they like to say about common sense, but they don't use common sense. Because what I speak of and bring forward right now would be common sense. It's not about privatizing everything. Because look at your prison systems. They're privatized. And because there's privatized, there's no real protection for the people. So that's why they're getting thrown in prisons, because it's profitable for them. And the same people that's running your government are part of the privatization. But some will say that I'm wrong, that I'm not. You're just being lied to. The guards, they're even corrupt. Slide them a few dollars and then do what you want. How do you think Epstein died? He was made to disappear. Still, like, it's still the same system. They're all trying to cover their asses. And get some money, and your community and your systems have gone down the shitter. I used to tell the kids, like, poop in the big toilet because the poop monster needs some food. Well, they're the shit monster. See and hear people screaming. Like, okay, like, I have somebody that, you know, they say that COVID is fake. They say COVID is fake, but yet they went to the doctor and they come back and they said, I got COVID. Well, I thought COVID was fake. Seriously, do you hear yourselves? Because I sure the fuck hear you. See, the thing is, it's not about having a debate with somebody. It's about going to the source of the problem. It's not about hollering at each other for what they believe. It's about having a look at yourself and around you. I seen a video yesterday on TikTok. Another guy was talking about it, and this man, he was on this video, and he was saying that he prayed to Jesus, prayed to God about to help him with this and that, and his to get him a house and a job and everything like that. And now he hates God because he's got cancer. It's it's that part of looking at the bigger picture of what is causing the cancers. It's your foods, it's your environments, it's your mental health, your physical health. Everyone has cancer cells. Just, I got the word, it ignites. Your body is at a disease. It's how your body's frequency is moving. Your internal. You can change it. It's not about praying for someone else to change it for you. When it's you who can work to prevent it. And it's not about doctors waiting until it's to the point where, your body is so sick that it can't even defend itself anymore. It's not about going and putting these chemicals in your mouth. But you're gonna do what you want. Which maybe you should start listening to the other side. See, this person that demonizes, kind of demonizes me for crystals or natural stuff. But they said about like where they went somewheres and they were going around doing energy healing, but they don't really believe in it. And why? Because they've gone into the dogma. She's like, go take your pill. Band-aid working out for you. Are you ready to rip it off yet? No. Last time I took any medication was almost 2 years ago. And that was when I was in the hospital. And it was almost like I got tricked. But when I came out the next day, I had told them I'm going to take the medication. I use CBD sometimes, but your mainstream They'll say, "Oh, well, there hasn't been enough investigation into it. Hasn't been enough research." Well, fucking shit. There's been more research into CBD than there ever was for those vaccines. I just heard, do you believe in the vaccines? It's not a matter of whether I believe in the vaccines or not. Because if somebody else gets the vaccine, that's their choice. Not mine. Should they be looking more into it? Yes, they should. Should be they be minding their own business whether or not somebody else got it? Yes, they should be. Same as voting. Who somebody votes for is not your business, or whether or not they vote is not your business. And that's why you have all this fighting about everything. See, some people may like a certain doctor because maybe they treat them differently. Maybe they don't have problems or the illnesses or what have you that other person that has the problem with the doctor because that doctor treats them differently. Because most doctors will treat patients with chronic illnesses really shitty. They're a burden on them in their system. No, the burden on their system are themselves because they don't listen to the patients. Patients telling them, but they're not listening. They're just going through the motion and by what a book says. So until that resident doctor, that one in residency has their full qualifications, they're not ready to take on patients with chronic illnesses. Even some fully licensed physicians shouldn't be a family physician. I'm going to leave it there. I just heard somebody keep talking. You administer vaccines, do you? Okay. And your point being, because you administer vaccines, do you know they were teaching people how to administer vaccines by using an orange? Is it saving lives day by day? Do you see those people after they get the vaccines? Do you know what their medical history, what their medical stuff is after you give the vaccines? So I say vaccines are a choice, but when there was COVID, that was not a choice. People's livelihoods were put in jeopardy. Their jobs were put in jeopardy. Their relationships were put in jeopardy. So, I mean, it doesn't matter whether you give people vaccines or not. You don't know what their life is like after you give that vaccine to that person. Only they know. No, it shouldn't be mandatory. You're part of the problem if you believe that it should be mandatory. And I'm not being ignorant, I'm just stating fact. You're a big part of the problem. And why don't you tell me why it should be mandatory? Because I'll tell you right now, that's against people's human rights. That's against people's choice. So you're saying to me that basically people should be held down and have that fucking needle stuck in their arm because you think it should be mandatory? You are part of the problem. You would do something by force because of what you're taught to believe in. Okay, I'll put it to you this way. Are the vaccines not are the vaccines not there to protect yourself, not the person next to you? So if you're getting the vaccine to protect yourself, why should it be mandatory for others? You're protected. You got the vaccine. No, they're not to protect all. They're to protect the person that has it, but it's actually affecting a person's natural immune system because you come in the world with your immune system intact. If you have a baby and it's a C-section, their immune system ain't so strong because they didn't come through the birth canal. They didn't have a natural birth. So a C-section baby, their immune system is lower, but you can build their immune systems up. I'm of the thing that, if somebody wants to get a vaccine, that's their choice. But for somebody to say that a vaccine should be mandatory, you are against human rights. And you are the ones that would administer a sexual sterilization act. I don't know how vaccines work. Well, maybe you don't either because science changes all the time. And do you know what is in it? Because the stuff they put in it, it's actually not a benefit for the body. It actually kills certain cells within your body. But like I said, it's someone else's choice whether or not they want to have the vaccine. I will have my own immune system. I got one of your vaccines. The thing is, it was supposed to be there to prevent you from getting COVID, but I seen people that got vaccine and they didn't have COVID before getting the vaccine, but after they got the vaccine, they're constantly having COVID now. Makes no sense to me. And I can feel your disdain and your anxiety and what have you. And, you know, it's a person's choice, it's not yours. Like I said, You're part of the problem. Well, I know someone who died from the vaccine, who was a healthy young person, and they died from the vaccine. See, the thing is, I done the research. With regards to how many people passed from the COVID vaccine or from the COVID itself, and how many people had the COVID virus, which, if people go look up ricin, you'll find out that it's exactly the same symptoms, and they tell you to do the exact same thing as if you had COVID. So I believe that COVID was more of an airborne thing, but it was ricin, not an immune disorder. I believe it was ricin poisoning. Yes, I did. Because what took me to ricin was because I did the research on George Washington. And they do use ricin as warfare. They put it in air, food, water, in your vaccines and your lotions, things like that. And yes, I did look it up, and it was on the CDC. And someone can laugh all they want. If you think this topic is funny, you're part of the problem too. Totoo crean. Di situ turista da kaysa da kemo to. Well, good for you. You laugh all you want. But if you think it's funny, a conversation like this, like I said, you're a part of the problem because people are getting killed and ridiculed and mocked like what you're doing to me right now because of all this. It's called a Holocaust. It's like you're taking us back in time and you're going back to a sexual sterilization act, which makes you the problem, not the people. I do go for a walk. You just go right back out of my channel or what have you, the same way you come in. You don't have to come into my channel and to go into somebody else's channel and tell them, see, it's not me who's getting aggravated, it's you because you don't like what I have to say. Because I can feel you right now. Because right now your heart is fucking racing. It's like, you should have consumed my body. Bring it. Seriously. I feel your heart racing. You're getting agitated and aggravated with me because you don't agree with what I say. That's fine. Like I said at the beginning, you don't have to. How about you go somewhere else and relax yourself because it's your heart that's racing. You're just causing my, well, you're not causing mine to. I'm just feeling your heart racing. Am I a sideshow to myself? Oh, well, good. At least, I'm not afraid to speak up to the demon in the room. Bisikleta mo saraya, ha? Gitu tuh ke, sikutu purikayam. I don't have a husband. I divorced him in 2012. Sikulen, ikutu purikayay. Shocker, hey? You like your insults, don't you? It goes to show how fucking immature you are. And I feel sorry for you. Maybe you should go be with your wife. She might give you a little feminine. Or wait, do you have one? Sikulen. See, I suppose you'd be the ones that say that for me to go find Jesus. I found Yeshua. But I already found it. Disse mo kiyasa. المشكلة وديسي كلام يموت عني كيرا disse كتب que no mundo criei. So keep going. Stand up for yourself. Don't let someone push you around and make you think that your choices are wrong. Whatever you choose, if you choose to get the vaccine, that's your choice. If you don't, if you choose not to get the vaccine, that's your choice. If you choose to just sit back and let the system keep going the way it is, that's your choice. But you actually came here to stand up to the system because it was a system that never worked. And it's coming to light now so you all can see. Right? So here in a little bit, I will be going live to talk about adoptions. I've been going to do this for a few days now, and I've just been like Spirit's been bringing me in for other things. Like today, Spirit got me to come in with regards to this. So, with that being said, I will see you all later. And in the meantime, I'm sending you all much love, light, many blessings, most importantly, very good health to anyone and everyone wanting, willing to receive and accept. I want you all to be big, bold, brave. Most importantly, be yourself. Be your authentic self. Be true to yourself and others. Be kind to yourself and others. And know that you have more strength than you can comprehend at times. Be you. And know that you are loved. Love you all.